Start. Welcome to our YouTube channel, Living the Good Karma Life. October is Breast Cancer Awareness Month. It began in 1985. The early goal was to educate women about breast cancer and early detection. During the month of October, breast cancer survivors and those with breast cancer are celebrated and encouraged to share their stories. My name is Ann Michaels. I am a breast cancer survivor, and I'm going to share my story. In December 2020, I had my annual routine mammogram screening. I never expected any outcome other than everything is fine. I was surprised by an unexpected phone call early the next morning. Someone on the other end telling me I had to return for additional images, possible ultrasound, and biopsies. Following these tests, I was ushered into a small room to wait for the surgeon. Dr. Kelly informed me that 3 lumps were seen in my left breast. She expected that one spot was cancer. She could tell by the edges of the tumor. Results of biopsies would later confirm her suspicion. She called me December 23, 2020, with confirmation of the cancer diagnosis. There would be another ultrasound and MRI to pinpoint and mark the location of each spot. We discussed surgical options as well as possible treatment, either with radiation, chemo, or both. I was scheduled for surgery in late February 2021. Enough time to do my research on a number of topics. Lumpectomy versus mastectomy, single mastectomy versus double mastectomy, side effects of chemo and radiation treatments, and what about breast reconstruction? I've been in pharmaceutical research of new drugs for almost 30 years, and I was a whiz at the internet. I also talked to other women who openly shared their experiences with me, pros and cons of surgical options, treatments, and reconstruction. Victoria, another friend, was diagnosed weeks before me. Her journey, much more difficult than mine. She too is a breast cancer survivor. Knowing someone fighting the same fight gave me a companion I could confide in. No one understands your experience, fears, and hopes like someone fighting the same fight. There was a lot of instant messaging between us for many months as we both supported each other along the way. When I first heard possible cancer and then the confirmation of cancer, I was in a daze, or maybe just in denial. I don't think I understood the seriousness of this diagnosis and the possible outcomes. As word spread through my family and network of friends and coworkers, the diagnosis became more real. The fear of the unknown hit me hard. Tears would fall unexpectedly on any given day at any given time. Of course, I discussed surgery and treatment options with those closest to me. I knew the decision was mine. My decision was not popular with everyone, but it was my decision. Taking all research and options in my memory, I had a phone discussion with the surgeon to share my thoughts. I told her I decided on having a double mastectomy. That meant I would not need radiation as long as all cells were removed, and the possibility of chemo was slim. I remember walking into the hospital the day of surgery. My sister Mary walked beside me as I was wheeled to the OR. By this time, I had a comforting feeling of peace with my decision, knowing that friends and strangers near and far had me covered with prayer. I knew I had the best surgeon and knew that Heavenly Father would watch over me through 6 hours of surgery. This was the right decision for me. As a result of my decision, I did not need chemo or radiation. Every woman's journey is different. I was lucky. My journey was relatively easy. I opted for double mastectomies. I opted not to have breast reconstruction. I have no regrets about these decisions. These decisions were right for me. I saw an oncologist soon after surgery and started on oral medication, something I would have to continue for 5 years. It's important for anyone viewing this video to know that my journey is not typical. Every woman has to make her own decision about surgery, treatment, and reconstruction. The decisions I made for myself may not be right for you. 1 year post-op, during an exam with my surgeon, she told me I was cancer-free. I think it's important for each woman to give a lot of thought to this diagnosis. Discuss your questions and concerns with medical professionals, family, and friends. And now, a little education. Breast cancer is one of the most common cancer types in the U.S. Early detection is the key in the treatment of breast cancer. Annual mammograms are so important. It can detect breast cancer up to 2 years before the tumor can be felt by you or your doctor. According to the American Cancer Society, when breast cancer is detected early and is in the localized stage, the 5-year survival rate is 99%. The chance of getting breast cancer increases with age. Nearly 80% of breast cancer is found in those over the age of 50. An individual who has had breast cancer in one breast is at an increased risk of developing cancer in the other. A higher risk of breast cancer is associated with having an immediate relative with breast cancer, especially at a young age. Certain genetic mutations, including changes to the BRCA1 and BRCA2 genes, are associated with a higher risk of developing breast cancer at some point. The task force now recommends women to start breast cancer screening at the age of 40 instead of the previously recommended starting age of 50, getting screening mammograms every other year from ages 40 to 74. I'm convinced early detection saved my life. If you are diagnosed with breast cancer, remember, your present circumstances don't determine where you go. They merely determine where you start. Don't be afraid to ask for the help you need, whether it is an errand or a hand to hold. Your family and friends do want to help you in any way they can. Cancer is a journey, but you walk the road alone. Give yourself a gift this October. Schedule your mammogram soon. And please remember to subscribe to our channel and to like this video. Thank you, and God bless.